Good afternoon. My name is Zayan Rameez, and I'm a final year student pursuing my undergrad studies in mechatronic engineering at Asia Pacific University of Technology and Innovation. I have the honor of welcoming all you viewers and our esteemed guests to our event. I was informed that our CEO, Datuk Paramjit, will also be joining us today. Sir, on behalf of our organizing team, I want to officially welcome you. We are humbled and truly honored by your presence. Before I introduce our guest of honor, let me first explain what the event is about and how today's event will proceed. This event is organized in aims of providing a better insight into the medical world and to identify opportunities to develop smart healthcare solutions. As soon-to-be engineers, we are keen on continuing the tradition of our fraternity in being problem solvers of matters that affect society at large. We will have a conversation with our guest speaker to glean much information on this topic. You, our viewers, are welcome to join in this conversation by posting your questions in the comment section. Now, let me introduce to you our guest, Dr. Roland Victor. Dr. Roland Victor is a medical doctor cum influencer in Malaysia. He specializes in the field of integrative medicine with key interests in hormone and nutrition balance. Having completed his medical degree, he pursued his master's in the public healthcare management. He also is European certified sport nutrition medical practitioner. The list goes on. He has been in practice for over 12 years in both government and also private practice in Malaysia. Dr. Roland is the key resident medical doctor at the KL Sky Clinic, KL's first lifestyle and wellness clinic situated at the Soho Suites, Kuala Lumpur, just close to the Twin Towers. Having over 80,000 following reach with over 2,000 critical medical content all over social media from YouTube, Facebook, and Instagram, Dr. Roland believes that preventive medicine is the only way to move forward in keeping people healthy. Prevention is better than cure. That was the introduction to our guest. Two of my course-mates will be the moderators for today's session, and then they are Jamila and Garab. Once again, I'll mention that today our guest will be Dr. Roland Victor. He specializes in the field of medicine in key interest in hormone and nutrition balance, and he is the key resident medical doctor at the KL Sky Clinic, KL's first lifestyle and wellness clinic. So I'll pass it on to today's two moderators, Jamila and Garab.
My name is Garab Doji. I am also a fourth year mechatronics student, and I have the wonderful privilege of being the moderator for this talk and sharing all the questions that you guys, that everyone has wonderfully made and compiled together. And my co-host will be Jamila.
Hello everyone, my name is Jamila Mathu, a fellow classmate in APU, pursuing my undergraduate in mechatronics engineering, and it's a pleasure to be here to moderate this talk. Yes.
So now I think we will proceed with the question answer session. So, Doctor, first of all, thank you for taking your time and being here and providing your expertise to us. So, the first question that we'll start off with is, what is the biggest challenge you are facing in your practice today?
So first and foremost, thank you for having me here. It's interesting to have a different segment of a discussion with students in engineering. So coming back to your first question, what is the biggest challenge that you are facing in your practice today? I think uh, as physicians, understanding what has happened during the pandemic, I think we need to move forward into a post-pandemic position. So practice is going to change a lot in seeing that how we can actually further automate the physical position of a doctor in the clinic, as well as how fast you can roll out services in the medical practice, and to ensure that the whole rollout process is very very smooth. So I think in a practice like ours, which is maybe of a level of a clinic, we might not be using so much of equipment or as compared to a hospital or a medical center. But I think the question will also be looked towards a medical center if we see it in a more bigger perspective on how patient loads. Because if you see in a scenario of COVID, we have a lot of high turnover patient movement. So data is going to be very crucial. How fast a person can actually exceed, or is it's actually pre-managed, whether they have a serious condition, whether they're pre-managed before entering to the hospital, and then they get the treatment done, and they get to be discharged as soon as possible. So efficiency in terms of equipment, in terms of medical technology assistance, whether you need ventilator, surgical intervention, the faster, the right time, just in time technology, all of this is going to be very very crucial. I think that's what's going to be this is what we're going to see, because what we see in the pandemic was a lot of makeshift healthcare facilities. You have countries being able to build a hospital in 4 days. You have to use military-based concepts, not just the technology, but the technology has to be very rapid. It could be dismantled very fast, almost in the perspective of a cloud. You want to move uh, a makeshift hospital from point A to point B. How fast can this be done? You have a load of patients moving from one point to another. So this is something very new, because we never saw a pandemic in the 19th in the 20th century. In this first one, the last one we had was the Spanish flu. So
I
these are
see.
things that I would say that we have to look further. What we have to plan ahead now. They cannot just sit back and let's look back at whatever happens to be coming out from the pandemic, but we need to look at how medicine is going to change, because the one that was really hit this time was medicine in terms of a global crisis.
I see, Doctor. So the biggest point is the rollout and the rapid movement.
Yeah.
Uh, I would like to encourage the viewers to also keep sending their questions in the chat, and we will choose the most relevant questions. On to the next question, and Jamila will take over.
Yeah. So the next question is, what are the most common risks that medical professionals have to face on a daily basis?
Okay, so medicine itself is it's a risky task. That's why it's left to the hands of professionals. So I think if you were to say the risk in medicine, it is a bread and butter for physicians, whether they are physicians, surgeons, and stuff. But I think what we need to do to understand in terms of risk management is whether we get the right treatment and the accurate treatment. So, and with technology that is coming. So, when we look at technology, we don't want to be backdated. So, if there's a physician 5,000 kilometers away has a better option of treatment, then we need to get access to that kind of information. So I think it's going to be much more of risk. It's not about the physical risk of us doing procedures and stuff, but in terms of what will be the best practice that we can get and provide to a person in need of medical treatment, how fast that can and how right that can be. Because if we have something that is really advanced and we have the tools towards it, we want to deliver it as fast as possible.
Yeah, thank you. That's very interesting. I never thought of that point of view in terms of like the physician's way. I always thought it was more in the hands of the doctor. So it's really interesting that that's actually where the risk comes in. Yes. Next question.
Okay, so Doctor, what are some of the smart technologies that are already operating at hospitals today?
Okay, well, when we look into smart technology, I think we have to see now the smart technology moving into two concepts. One is, what smart technology can you bring into the hospital or the practice, and what smart technology that can exist in the practice. and then you need to see whether both of them can actually coincide. For example, maybe if you have a smart phone or a smart device or a wearable, how good is it when you bring the wearable into the clinic and say, "Doc, I have my blood pressure or I have all my records, and I just have to maybe beep or maybe give you a QR code." The sync can automatically happen into the system of the physician, where some sort of like an API exists symbiotically. We don't have to like get permission and everything. It's like almost like a well known. It's just like how you share one information on your WhatsApp. You can move it freely. If like when you have a photo on WhatsApp, you want to send it to an email, it just happens in a snap. And I think that's something in terms of technology has to be looked at. But of course, in looking into the common technologies we have, RFIDs already placed in many hospitals, I think even in Klang Valley in Malaysia, where you have the right amount of usage of devices, for example, like portable x-rays, portable ultrasound machines, and they can actually do it just in time so that they know that equipments are really well utilized. That is in terms of patient sharing. But of course, if you're looking at smart technologies, there's a lot of surgical procedures done with the help of either telemedicine, either with the help of AI, artificial intelligence, coincide with the surgeon. So there's a lot of technological robotics which come with assisted or guided steps with the physician or surgeon inside during procedure. So I think those technologies for me, what I would say, it's already been there. It's been there for at least more than a decade. And I think what's happening is it's being refined time after time.
And Doctor, these refined technologies, are they using the IoT platform now?
Yes, definitely. I think the IoT platform, if looking at the Internet of Things, uh, and you're looking at the technology where it's going to be, you got like 5Gs coming out in perhaps maybe by next year. You have machine learning by themselves, and you got a lot of this data coming from imagine that it's coming from 1,000 surgeons, and this input can be placed and the machine starts learning from one to the other. When that happens, that's going to be fantastic.
I see. And Doctor, what other advancements would you prefer to be developed when we're talking about this topic?
Wow. I think I think the sky is not the limit for this. If we were to just look like 50 years ago, where technology was and look at what we have today, I think technology in medicine has extremely seen a big, huge quantum leap, and this is just going to be going on. I mean, I would only say like surprise me. Everything and anything can happen in terms of of the technology. So it's always, I would say, is looking at how fast we can embrace technology. Even if we were to look at just look at uh, a year ago, maybe we were still in hope for a vaccine to come out, and in 9 months, in fact, companies like Moderna were actually able to code the spike protein in less than 48 hours. Less than 48 hours. It's all because of technology. So that whole process of waiting for like 5 years to develop one technology can be done, can be brought down in less than 48 hours. So in terms of technology, we are just constantly going to progress. I think with the help of young engineers like y'all, I think there's going to be more and more tech coming out. But for even a simple example, I would say 1 year ago, you would have not imagined that someone could actually buy like a stand held thermometer that you access and walk into shops, which probably costs like 400 ringgit or maybe even lesser. A year ago, if I was not mistaken, I think in the month of March or February, we were buying, the government were buying infrared thermometers to use at the airports, which maybe cost like 20, 30,000. So can you see in just 1 year how something actually dropped its price? Because of technology, because of engineering, because they just knew how to put A and B together, synchronize it, and it's accessible. So things will change. How fast medicine will change, and physicians as well as patients as well as engineers are going to reboot, redesign, rebuild, and constantly do that and adapt.
I see. Thank you, doctor, for your input. I guess it's about time we proceed to the next question.
So the next question is, what are some hindrances in your practice today that you think could be overcome by technology?
Okay. So when we see in terms of hindrance, I don't see it as the word as hindrance. I think we got to see this as a growth. What we can actually redesign and make a practice better, whether it's in the hospital, whether it's in clinic. What we need to look, what I see personally is getting the whole process as smooth as possible, keeping a patient who is coming in pain and keeping their experience as comfortable as we can. From the point whether they enter the practice or a hospital or a medical center or even, for example, our clinic, how to keep the experience smooth. There's no hiccup in terms of glitches uh, from maybe blood taking to getting the reports out, making sure that they're right, making sure that the physician gets the results in time. There's no like delay in terms of like printing and waiting. There's a miss error in information and back and forth. So even imagine that if you can know when the lab runs the test, you can actually schedule the patients like, you know what, I want this test done. It's going to be out on on Thursday, and I can get it by Thursday evening, and on Friday morning I can see you. So you get all of this. So technology is going to come in terms of putting all of this together, and uh, and that I would still say wouldn't use the word hindrance, but I think it's here how we actually going to move this to keep the experience more seamless and getting the patient the best outcome, the fastest treatment, the safest treatment, and the quickest recovery. That's what I think uh, doctors will look at technology. How is technology going to make my patient recover faster, better, and stronger? It's going to be very important.
Yeah. As a follow-up question, I'd like to ask, what other specific processes could be automated in your practice, for example, or that have room to be automated that you'd give as an example in this case, other than
Okay.
for scheduling?
So just in a nutshell, let me share. Okay, what I face. So, for example, my practice is a wellness and lifestyle practice, uh, and we have systems like medical systems where we have the patient registration and documentation and stuff like that. But what we face today is still the lack of integration between applications. That means the basic backbone of uh, a software that we use to document and register our records are still not sort of like, I would say, like, it's still not booking friendly. It's still not social media integrated where people can just click the button from the social media book and automatically comes through the calendar. We still have to use, like, there is still a bridge to cross. For example, if one has to call, they might have to call the clinic. Maybe my one of my nurses would have to register them in the clinic, maybe put them in a calendar, maybe put them in a Google calendar, and so that it's easily accessible. Because maybe some apps are cloud based. Some older physicians maybe would have still used a hardware based kind of application, which we will look at later in terms of PDPDA and stuff. What we see is these are the glitches. So when you have an interaction, even the software sort of like the patient also carries like a clinic data. That means their personal medical information data management system with them, And I see that maybe, for example, like what we see today has happened. Like I would say, My Sejatra is the most used app in the whole country, and an app of a healthcare app like that should be not just left going into silo. Maybe in a couple of months, if we successfully come out on no QR scannings everywhere, it should evolve into other things, where imagine people could actually keep all the medical records, and you can go to any registered physician or any registered clinic, and you can pull up your whole information. So the patient, we can see maybe a 20-year record. For example, uh, if this patient from young has a high cholesterol issue, and that has always been there, and it is not because of his lifestyle, he's very good in his lifestyle management, or maybe it's just there. As how much you try to fix it, it doesn't happen. Sometimes some situations can be such. So, and then if you go and see physician A, physician B, physician C, and every time they say, hey, your cholesterol was bad, hey, your cholesterol is high, hey, your cholesterol is high. And even though given certain medications, they do not respond. So then this is where you can say like, look, doc, you want to see 30 years of documents I got? It's always been there, and I have actually practiced a very healthy lifestyle. I do not eat junk food. I do not eat fast food. So then the physician can say, oh, okay, you know what? This is maybe congenital. Has been like that. You maybe have the levels have always been high, but you're basically healthy. So these technologies, when you bring along, I think it's going to be very useful for the young generation. It's going to be like maybe for millennial upper, so they can actually look at the whole trajectory. You can actually see a charting for years. You're not looking like we're just looking into a small narrow tunnel of 6 months, 1 year, and stuff like that. And in fact, one of the things that I uh, did try to do in the just before the pandemic was I was actually working on a project to help corporate companies reduce their cost of medical expenses by going into looking at non-communicable diseases, for example, like diabetes, hypertension, high cholesterol, heart issues. We're looking at BMI index of the company, looking at the stress levels. So where we could actually look and pinpoint which departments were having healthcare issues. So we developed. I worked with the team of IT engineers in India to develop a system where the physicians that were seeing them could see the whole spreadsheet, and the HRs could see the data in terms of percentage. Like, hey, this finance department was having a lot of people are having hypertension, so they need to go and see why were they having that? Were they overstressed with work? Were they suppressed? Were they depressed in in the department? And then they can actually find interventions, because when we look at preventive medicine, a lot of companies are heavily also paying high insurance premiums in terms of keeping their staff healthy or seeking aids. But if they were to do screenings gradually, maybe every quarter and stuff like that, to track how their staff health were, they can actually pull out the data, not personalized data, but collective data, to see, like, how healthy is my company, or how healthy are these departments, what are they facing, are there issues, or maybe one department like marketing, maybe they're all having high levels of cholesterol, and their BMI ratio was very high. Maybe they were spending a lot of marketing funds eating. We could actually trace that and see how the progress was. They came in when they were 25, they were only 65 kgs. 5 years down the line, when they were 30, they were already 85 kgs. They increased gradually 4 kgs on average. So these are the things that we were trying to do. But unfortunately, when the pandemic hit, the shift was much more looking at communicable diseases rather than non-communicable diseases at that.
Okay, so I guess what I got was integration is important still. There's room
Very.
for growth in that area. And you mentioned that you still require data analysis happening also within the field. So that's really interesting. So yeah, next question.
Okay, so doctor, what parameters are considered as vital to be checked, and how often should they be checked?
Okay. So when we look into vital analysis, I think one must understand that the the field of medicine is very broad. So maybe for a general practitioner, maybe the basic vitals, for example, like your blood pressure, your pulse, temperature, maybe some amount of physical examination would be necessary. But for example, maybe like a surgeon who is doing a certain specific procedure, like maybe a breast tissue removal for cancer, maybe they might be look for much more various kind of parameters. So the parameters for physicians is very broad. So it should be looked into like tailoring into specific parameters. Maybe some use different blood parameter markers. For example, a hematologist would be looking very meticulous into white blood cell count, red blood cell count, platelets, etc. But maybe for a orthopedic surgeon, maybe that would be not the most crucial vital parameters. His vital parameters may be more focused on an X-ray or maybe a CT scan or MRI. And then if that's going to be coincided with maybe an AI to help him diagnose faster or better or even more accurate, that doesn't or bring down or I would say bring down the quality or the criteria of the orthopedician, but actually it gives him a plus point. It gives him like a brother, I got your back kind of thing with the AI comes in.
I see. Thank you, doctor. And that was a very concise answer. And let's move on to the next question.
So the next question is, what key features would you suggest for an app designed for long-term patients?
Okay, so when we look into app design for long-term patients, I think just like I mentioned just now, a platform for the human resource. I think that what has happened in the pandemic allowed a lot of apps, a lot of medical tools to evolve very quickly because the technology that was pushed in, uh, that technology that was pushed in to actually trace, contact, isolate, monitor was very crucial, and we saw a high speed up on this sort of documentation technology being available. So uh, key features to suggest in app design, definitely it's still going to be still going maybe from the beginning. It's still going to look into the basic vital components, maybe like temperature monitoring, blood pressure, glucose, sugar, which maybe the individual can do it themselves or with certain machines which can sync with sync technology, for example, like Bluetooth, Wi-Fi, and stuff like that. So automatically it feeds either to their mobile phone or their laptop or their computer or their phone or whatever, and it's stored as data, and then it's automatically stored into the app. So whether it's for long-term patients or short-term patients, I think the medical tech will definitely push its way there. I think it's already happening. It's going to happen. I think it's going to happen uh, more rapidly with all the tools we have at the moment. So the thing that I'm happy about is that the leap of computer technology, wearables, applications are moving up. But there's also another problem I see when everybody wants to create an app. That's also going to be a problem. So when everybody wants to create the app, one must also understand how different is your one app compared to the other. Whether there's going to be more mergers of apps where everybody can just use like one, and which is the most convenient like that. So we seen that happen. We seen that happen on social media. We see that happen on like WhatsApp, WeChat, everything. The dominant apps. So the dominant apps are going to be the driver in terms of how fast they're going to see this necessary. They're going to pull it into the system. And when that happens, then if there's a common API that companies can sync and use, especially medical technology, especially the big players, that would actually transform a lot of things.
Yeah, I think also what you said earlier applies here when you said the ease of integration. Like if we're able, even if there are millions of apps, if you're able to sync your data, I think that'll be easier for the doctors and the hospitals to collect that data and work well with it. Okay, so next question.
Before asking the question, Doctor, I must notify my viewers that our viewers that we are about halfway through the questions, and I urge everyone to utilize this opportunity to ask some brilliant questions because the doctor is here, the expert is here, so it's a great opportunity to use this time. So on to the question, Doctor. How effective is remote monitoring of patients?
I think that's going to be super. Having access to remote monitoring can be from the context of self-monitoring with a guidance of a physician or a healthcare worker, where, for example, it could be a nurse, uh, it could be a caregiver, that they are actually able to monitor the patient from remote. That allows the healthcare individual to actually reach out to more people, because sometimes remote monitoring of at home monitoring would require you to actually move, would require the physician to move from point A to point B, would require the nurse to move from point B to B, just in order to get to get that. So effectiveness is going to be looking down into how efficient the remote technology is first. For example, maybe like you might be able to buy maybe if you have seen, I think in a couple of months you have seen a lot of shops, even grocery stores selling SpO2 monitors to check your oxygen saturation. I'm pretty sure you've gone to maybe even those convenience stores down the road, they're selling it at for as low as 20 or 30 ringgit. And I did ask one of them, is this a medical grade SpO2 monitor, and is there a guarantee that it's going to work and last? Is it robust enough to last for at least 6 months or 1 year? And can you get a right reading? And I asked him to check and see. They said, "Sir, there's no warranty even for the item. So if one uses an item like that and does personal monitoring at home, and he suddenly sees that his SpO2 is 70%, but he's breathing normally, he's going to get paranoid and run to the hospital nearby. And then when you check with a medical grade oxygen saturation monitor, is 99%. So sometimes, so that's where it comes the right technology and the spec has to be right, has to be a good, has to be of a decent grade. It's not just about the price war. Second thing, when we're looking at remote, we're going to save a lot of costs in terms of getting physicians to move from point A to point B, where they can actually track and monitor themselves. For example, like blood checking, sugar reading, and stuff. Because you have those simple, affordable equipments, once it's scaled up with good quality, you are able to access at home. And then the physicians rather just come in, whether by text, by remote, by video conferencing, by telemedicine options, to actually assure or guide the patient. So it's definitely effective. We are using it uh, all the time, unknowingly, whether it's a phone consult, whether it's a video consult, whether it's a text message, whether it's a screenshot of their reading. This is constantly going. What we need to move now to be much more effective is piping down the data as fast as it can be. So, example, like what Jamila also mentioned, the integration. I think the biggest thing, the take home, is the integration today. How good can one's voice message or one's image can be integrated and is actually hardwired to this person's data bank, whether it's going to be a crypto technology, because we fear of data protection. All of this is all possible at the moment. It's just that when the big giants and the big tech comes in and embrace it, like boom, you have it without even thinking a doubt. It's there already.
So, doctor, do you see a future where only remote monitoring is done to the patients?
Good question. I think that definitely very possible. Of course, even in a hospital, let's just say, when the physician is maybe at his office and he has maybe like five uh, people in the ICU, and he can maybe from his just by logging in to his nurse's desk in the ICU, he can already monitor what's going on, and he can actually just ping immediately while in between his patients in the clinic. He can already just like cue the thing automatically to increase the dosage. Or so even if you say like remote monitoring, maybe the pumps of infusion can already be navigated. It's just that he just gets approval, he signs in, maybe he puts in his password, he gets access, and it's all logged on where to say that look, he needs an up 1 gram of maybe a dopamine. He just has to click, he increases automatically because of the ability of for him to see the dashboard, automatically he can actually respond. So it's there. It's already possible. I think in fact maybe it's already happening, and people are maybe certain researchers are already doing it. Maybe some big companies, tech companies, big pharma are already doing this.
Thank you for your input, doctor. Let's proceed to the next question.
The next question is, what are some common problems faced in terms of database management for telemedicine?
Okay, I think the question seems to be like almost. I think it'll probably be the same answer. So, everybody tries to say that medical data is it's private and personal and stuff like that. So, I feel the problem we have today is because we cling to that idea, because we feel we are more worried about the risk than the benefit. I think this is where I think we need to see like what is the benefit that you can get, that rather just looking at the data protection or data secrecy. Because let's face it, if you were to put a 1 million ringgit in a bank today, as much as the security is high, information like that can still be leaked out. Still can be leaked out. So what are you going to do about that? Can you blame the bank? Can you blame the bank and say like, look, oh, they have the best security protection they had, but that information came out. Jamila had 1 million ringgit in XYZ bank. It comes out live. So what we're gonna do? Yes, I have the 1 million. So what are you gonna do about that? Nothing. It's still protected there. So again, if I were to tell you that if a trained physician, I can see, imagine if I go in front of a shop where if you go in front of a restaurant, everybody is writing their temperature, everybody is writing the age, everybody is writing their IC number, phone number, and everything. And I can see all the temperature readings there. Do you know how much information I have when I see that? I can see what's the temperature, what is the room temperature there. Are these people having fever? Even if you're just filling up. But a trained eye can see beyond that book. What's going on? Is there a lot of people having fever inside before you even step in? Because see, this is where we feel like, is there a medical data inside there? Yes, there's a temperature data inside there. Is your age being captured? Yeah, if you fill up your IC number, I can already see how many young people or how many old people are inside there. If I was a person going to do a heist, I can already calculate what's my risk of the heist. Do you
So,
get what do you get what I mean? Right? So when we argue about this thing in terms of data protection, where are we going? Are we just stuck fighting about data protection, or are we just looking at moving forward, like what this data can actually bring to a better health? What kind of this kind of data, when we actually able to data mine ourselves, plot the chartings that we can see? Fine, we are worried about things that are kept in one silo, kept in one singularity in terms of one account, one mainframe server and stuff like that. But I think as we know, there's going to be like crypto technology and stuff like that. We definitely can look into other options into how we data and cloud manage all of this information. It can be scattered everywhere where we can actually pipe it together. So all of this is already possible in the current technology. It's all about whether the technology is now being used to put to better health rather than just being worried about data management issues. If you look into another perspective of data management, is much more of how fast and how integrated is the data coming up. So if the data comes up is easily accessed, the patients can put the data in together with the physician. So then there's a much more better network. So maybe the patient has five specialists that they have to see. He has gout, he is seeing an orthopedician for that. He has a heart problem, he has a nephrology visit. So imagine that these five doctors can actually see what are they managing together and also come to conclusion to actually manage him better. Maybe that few doctors can also interact. They need to do like a video consult on his management. So these are things that we are going to move forward. So are we just holding the data that we don't want to see what we are doing for this patient, or we don't want another physician to see what we are doing, or the patient just wants to keep it all to himself? These are
I
the things.
think I think in terms of like the medical data, if people were to move into being more open-minded about sharing it, for example, um, I think the fear now would come in terms of the security, in that people might not care that most people can see it, but I think it's more how someone else might use it for a tool of evil. We still have to think of that other end of the spectrum, unfortunately. But it's interesting how, in terms of data, for your end, it's more like, let's just reveal all because it'll ease everything. So
Yeah,
I'm
I
50%
see
convinced.
I see it in a two ways. I get what you mean in terms of, let's just say, like, you have a fracture in your right femur, okay, and someone gets access to that. They know most likely your weakest leg is your right leg to attack you. Okay, so but imagine that the information is already there in the system, where the physician, maybe sometimes you would have missed, you had an allergy to some drug 10 years ago, you had an issue where the AI can actually capture so much of information and summarize even for the physician who's seeing you then, who might know you maybe had an accident on the road. And when the physician gets you into the ER, he just scans your code, pump, he has access. So the access, okay, the access, I think it's much more of an access. Who can get the access? Is who
Yes.
can get access. So maybe that's when the, okay, if is it a registered physician can get the access? Is it a government hospital can get access? Because in order to get access, we can rightly manage this person. Maybe he has a specific allergy to certain painkillers and he has fainted, and you want to give that, and he gets another reaction. So these are the things that maybe I would think about, because I feel the issue that is always, when it comes to data protection, is always so much more of security. What if someone steals? How many times have you gone on a manual documentation record when you go to the hospital and say, "Oh, I'm sorry, the data is missing, the card has been misplaced"? What are you going to do about that? Nobody cried, nobody whined, nobody did anything. And they say, "Okay, well, we'll just open a new card and start all over again." It has happened. It happens all the time.
Yeah. I kinda am starting to agree with you in terms of like, yes, no one really cares. But then also you forget that there are some taboo topics in the world. Like, what about the such? So of course I still, maybe I'm too old school, but I'd still like to know
Yeah,
that
I would, I
the
would, I would say, even like that. You see, even in the terms of whatever is happening at the moment. When you go outside, you need to show that you are vaccinated. Isn't that
True.
your personal data? People don't need to know.
True.
There are people who are vaccinated, maybe have certain risk or certain benefit. You do not know what's going to happen in the 6 months, 9 months, 5 years when more clinical data comes in. Someone has actually can access that. Someone, not you, maybe the ministries, maybe governments can access to your health behavior. How do you see that? If you are or visiting to every single shop, and if you are like 9 out of 10 visiting fast food restaurants on your app, I can already plot you that you are a high risk person, that in 5 years time most likely you have certain illnesses.
True.
How do you say, how so one, the term of defining that data, whether it's health not health, whether it's personal non personal, it's going to be very challenging today.
Yeah, a thin
It's going to
line.
be very challenging. So today, like example, like if someone scans and say, oh, you had COVID before, or you had COVID twice, are you going to be a risk? So all of these things are going to be interesting things to see, like how data is managed. So uh, I think there's need to be much more openness or accepting data than just fearing data. Again, like just like a scenario like in the bank, you could have the money in the bank, the information goes out, fine, the data was compromised, but did we do the best to protect the data? I think that must be the question. Did we do the best to protect the data? Because people are going to still hack and try to break the system. Humans are always being rebellious. They will try to look at
Yes.
finding a way to break the system, and that's what makes us better. We always want to break the record.
True.
So when that happens, we
Definitely
tend
true.
to move on a higher technology, a more higher security. So that is definitely going to happen, going to evolve.
Okay. Okay.
That's quite
Thank
a
you for
long
that.
topic we discuss here. Done.
Yeah. So thank you. Yeah. So this is the next question.
Okay, so we were supposed to have a question before this, but since the doctor has already covered most of the topics, which the question was based on the doctor's opinion on data protection. But let's move on to the next question. So that would be, what is your opinion on smart delivery systems for prescriptions?
Okay. When we look into smart delivery systems, I think we are going to definitely touch into the gig economy. We have so many gig economic players in the market, whether it's locally or internationally, and some gig economic players have already tapped into this. I think, in fact, in our small scenario, in a small scale practice, we are already using smart delivery system, but maybe still in a primitive way. For example, a person wants to continue his prescription. He wants to get a specific tablet from our clinic, and he sends me a text, sends my staff a text. Yeah, he wants to get the medicine. He wants to continue the medication since it's due to just do a refill. So my staff then tells him, okay, this is the billing amount for the item, because you must understand certain medications cannot be just sold over the counter. We need to have at least some registered amount of medical data in the practice for us to think. So if it's already stated in the documentation, okay, continue for the next 3 months before the next blood test. So my staff will go through it, and okay, yes, we have the medicine in our practice. What's next? They then send uh, the amount for them to do an electronic transfer, and then we will then use either a short delivery system or a long delivery system. For me, maybe someone who lives in the city, instead of just using a more longer logistic system, you might just get a Grab or Parala Move or whatever e-hailing system that is available. Send it out. Within half an hour, the medicine is in the hands of the patient. Maybe someone who is across in Sabah, we need to send a medication. who can't come into care but needs the medication supply, I can then do a consult with him online to see how he's doing, and then say, I think maybe you need to continue or change the dose. Then I will key in a prescription in the clinic, either send it to him or maybe he can purchase the prescription there, or I can even choose if I only have the medication and the clinics there don't have it, then I can then send it to him by remote delivery system. So the issue here we have is a couple of things. One is integration of system again and again. It's going to come to that. And another one more thing, and I think in terms of the integration, I think even though I think if it comes with a cost, a minimal cost, when the scale is huge, I think the benefit will be significant, that physicians, practitioners would be very willing to actually pay to enjoy the service because it streamlines the whole operational process. For example, I give you a scenario that is there any distortion effect at the back? I hear there's a lot of rumbling sound. Okay. I found it. Okay. So, coming to the question. So, I give you a scenario where if it's a prescription medication, for example, I have one male individual who needs a prescription of Viagra. Okay, and I am not able to put a drug like that online, even on my website, like add to cart. It's technically illegal to do that. So that creates, like, I have to sort of, like, in order to do that, I have to think about making a back end. He has to have a login to my website, and then he can prescribe based on him. Okay, he's allowed to buy this is his shopping cart. Then it's going to be different, but it's going to be very, very tedious. But it's not possible. It's definitely possible in the future. So these are the drugs that you can prescribe. The doctor can prescribe you. So if you finish, you can just click and order. That can be done, and then automatically, if there's an API linked to the logistic provider, boom, without me knowing, automatically it goes into the bin, purchase, exit out. And that's when we feel like in terms of system prescription, the AI will then come in to maybe assist the physician. Maybe the physician will just get a message on his application saying that, look, patient XYZ had wanted to refill his Viagra medication. Did you approve or not? Okay, this is his last date he purchased. This is history. His last blood test was this. It's just all I need to do is just click approve. So can you mean I click approve automatically? Whether maybe I don't want to keep it in my clinic, maybe I'm using a secondary support system, maybe a pharmacy out there. They have an integrated application with this. I don't have to keep any stocks. Also, in fact, there is maybe a marginal profit can be made from the drug. The pharmacy makes a marginal profit, and the pharmacy has the logistic system, maybe from their warehouse, goes up. So can you imagine, like, that whole process of me getting a WhatsApp, me having a tiny chit chat, sending the bank account information, and he pays, he sends to me, and then after that I text my staff, and then my staff writes the form, fill up the form for the logistics, go to the post office, or goes to the delivery center, send in, or even call Lala Move, and then so can you see, like, they probably have like 8 or 7 interactions other than if I could just click approve, pop, this goes out. That is what the future would be. I'm already seeing this happening in less than a couple of years to come. I think maybe it's less than 5 years we will see this already. Wow, that was long.
Thank you for the input, Doctor. I believe we are at the last question now, and so.
I see a lot of questions from the chat.
Yes, Doctor. We'll go through them after this last question,
Sure.
which Jamila will read.
Okay, so the last question, pre-prepared question, is would having an autonomous system to dispose of harmful materials, such as waste, be a necessity for medical facilities?
Definitely. Definitely. I think no questions asked whether you're talking about highly radioactive substance or radioactive formulations. Maybe there's segments known as like nuclear medicine. Definitely, I think they're using the technology of like robotics, using chemotherapy items. You need to be kept in a very secure position. How it's actually carefully handled because they have some radioisotopes and stuff. So machines, robots will be definitely used into this kind of display. But I think if you're talking about like basic disposals like sharps, needles, and all, definitely, as much as you can have a robotic uh, cleaner at home, moving around at home, I think this is definitely possible in the technology field. It's not going to be difficult at all.
Yes, I think so too. And also, since the arise of like COVID, it also brought this need to the front for a lot of the frontliners, I think.
Yes.
So, yeah. So that's the last question. I think now we'll pass the floor back to Zayan, who's going to continue with the additional questions. Zayan, I think you're muted.
That was awkward. I'm sorry. Thank you, Jamila. Thank you, Garab. And thank you, Dr. Roland, for answering all the questions that we had from our class. And as the event proceeded, we have some questions from the chats, like you mentioned. We have many comments, and I think I should proceed to those questions now. Once again, thank you, Jamila, and thank you, Garab. I'll be taking over from now. So, Doctor, there's a set of questions, but before that, I go through the questions in the chat. I would like to ask you two personal questions from my side.
Okay, sure.
Okay, would that be fine?
Yeah, sure.
Okay, I'll use my opportunity to ask you these two questions as well. So, so in your opinion, Doctor, how open is the medical fraternity to embracing technology?
Wow, that's quite a hard question. I think you have to understand two scenarios lah. I put it very hardly into this lah. I think there's gonna be the cyborg doctors and also the dinosaur doctors. So there's going to be a young set of doctors who are very open-minded into technology, embracing it, coincide, and there's going to be one segment who's going to be resilient and pretty comfortable with the old ways of things are done. Nobody's wrong or nobody's right. I think it's going to be into their own comfort or their own goals, what they want. But see, change in change there's not going to be a push. There's going to be a shift. Either you sit and do nothing, and change will just roll over you, or you embrace it and become part of the change.
Okay, I have a similar question then with your answer. So, what us as future going to be engineers or the current engineers, what can they do to endear us to you? Like, what can we do?
Okay, so I see first of all what will happen in the future is skill sets. In terms of when we go into varsity and when we go into training, it's not going to be just stuck in just one field. I think maybe you might have like maybe in medical school some doctors learning robotics for the future, some engineers learning some part of medicine like physiology, anatomy. If they have some special, because you need to understand what goes on in the game. At the same time, engineers must understand what the doctors will anticipate. So having uh, the dynamics of different field is going to be the key. Players who understand different segments or different role plays, this is where we're going to see the benefit come. For example, if one doctor has the ability of coding, can you imagine he can code his own software? He can actually do something that he really wants, he really feels custom made to his practice. I want to see this only. I want to see this data. How to pull this data out from my PDF, or when the email from the lab comes automatically, it can sync the request on API. So that the symbiotic breed becomes whether I want to do the surgery in this style, I want to format the surgery or the AI, or whether the machine learning to the way I do the surgery. So then the AI like intervenes and said, no, you missed by an inch. This vein is not here.
Very interesting. I hope that
Yeah,
could be a prediction of the future as well.
yeah. So
Like
so I
where we
think I, I
see,
think I think I think schools education is all going to change. I think we're not going to be stuck. I mean, in terms of like, oh, if you go to medical school, this is the syllabus that you need to have. No,
okay,
I think that the integration of knowledge is going to be like everywhere. Whether you learn how to do programming, whether you learn how to do robotics, whether it's your Legos that you play, it's going to help you into your orthopedic surgery. This is going to be the future. This is going to be where we're going to put all our knowledge together and fix something. And it's going to be like super duper web like that. So no one is like when you come in, like I always tell people who actually come into the clinic, what are the skills you have besides being a physician or besides being a staff nurse? Can you do other things now? Can you read musical notes now? Can you operate a turntable now? Can you do a good PowerPoint now? Can you speak different languages now? Because all of this is going to be is the one who's going to be helping.
to build the future, I suppose,
Yes, in whether it's
in
in
adaptivity,
medicine,
right?
whether it's engineering, it's all going to be there. What other skills that you have?
So I
That's
hope
going
we
to set the
engineers will
difference.
be working hand in hand with doctors in the future to build a better society, I suppose.
Definitely, that's definitely needed.
Understood. So thank you for giving me the opportunity to actually ask two personal questions. But shall we move on to the questions that are in the comment section that our audience has sent to us? Okay, I'll start with the first question. Okay, are we able to see? Okay, who will be the new, as in, what will be the new role in medical doctors play in some of the practices will be replaced by smart technology? This is a very, how can I say, a very disruptive topic, but I think Doctor, you'll be able
Okay,
to give.
I think I probably answered Alex's question. I think the question is when we have smart technologies coming in, I don't think there's going to be any replacement at this moment. We never know the future what's going to be, whether because all going to be AIs sitting down like the Matrix inside. so so it is all used like batteries. But what we see is the integration. So whether can I say like the laptop that we have or my video cam is a smart technology? It is a smart technology.
True.
We would have not done this a year ago if we didn't have this kind of technology to pipe in uh, 20, 30 people to have a conference online. We probably have to go in the hotel, sit down, buy some tea, eat some curry puff, and have a chit chat. But today you can actually do it at the comfort of your phone. I could consult a physician uh, in San Francisco in just 5 minutes. Have a video chat, send out some of the medical information of a patient here. I need some help. But it didn't happen maybe 20 years ago, 30 years ago. So we cannot just look, we have to look at the journey. The tech has definitely improved, and smart technology is the thing now. With the 5G, with the IR4 coming in, this is happening, and it's not going to displace anyone. It's just the question is, are we evolving with the technology?
I believe adaptability is going to be the way that we'll
Yes.
be surviving. So,
Yeah, you got to be fluid with this. You got to be fluid.
very true. The world is smaller now, with the mention that you can have an opinion-based question with someone halfway across the world in a new time zone. That sounds very interesting, and I hope things will get even more surprising in the future for our better. So let's move on to the next question. The next question is, has there been any study on the effects of 5G, 6G on human health? And if there are, what are these and what are the impact of any?
we don't. I think I'm not able to answer this question. I think there's a lot of taboo with the technology in
There's
terms of
quite a
the
lot of
frequency.
misconceptions,
Yeah.
yes.
So I feel that uh, they don't do much of research towards this kind of impact when it's like using like a frequency, radio frequency. There's very little studies done. So until further studies or governments really honestly taking research, carrying out and being transparent, that's when we will actually find out whether there's any harmful impacts. But on this side tracking on that, Nabiha's question, your Wi-Fi at home still sends frequencies into your body, and some people actually don't even off their Wi-Fi's at night. They don't even off their phone data at night. They keep all of this GSM technology and Wi-Fi
So, yeah.
constantly beaming through your body. And remember that when you sleep at night, your body is almost in a static position. Don't you think there's a lot of molecular vibration happening in your cells? Definitely. It's just that we're just looking for always what's future going to come, what we have today. And I tell some of my patients that try offing your Wi-Fi at night and sleeping, or don't keep your Wi-Fi in your sleeping environment. Don't charge your phone beside you. Off your data. If there's any emergency, people might call you, and you will see you will even sleep better. That's a medical tip.
So I guess there is a need for proper research, right?
Yes,
And
definitely,
you
definitely.
believe that government bodies, or actually, let's say in a perspective, reliable bodies to actually have proper testings needed for these technologies, right? So I've
Yes.
never even thought of turning off my Wi-Fi at night either. So let me
There
go
you
through
go.
that. And let me ponder about it and maybe turn it off tonight before I sleep. So shall we on to the next question? The next question is by Manikant Cloud, an app to host all our medical records. Can this be integrated with insurance companies for seamless transactions? So I guess he's trying to merge the data as well as to our, how can I say, everything is business related, I guess, so, and insurance related. So what's your opinion, Doctor, relating to this question by Mani?
Definitely, there is an ability to do that. But I think in terms of, I think the question always lies is like, how secure is one app or one standalone app everybody is using? That will be the question. So the safety. So whether we need to move into a blockchain technology to keep these records, or we need to find newer technologies that will come along the way. That will be the. I mean, we have to use what we have today and move forward. We
Move
cannot
forward.
like plan, but no action. I
Yeah, I
think
suppose because
in terms
yes,
of telemedicine and all, what's happened in Malaysia was a lot of this waiting game. You have Malaysia has a telemedicine act, but in terms of how much it's used, it's much more of people. Oh, you cannot do this, you cannot do that, you cannot do this, you cannot do that. But what can you do?
true.
Tell us what we can do. Don't tell us what we cannot do. That's the wasting time thing that's always happened. It becomes a PDPDA and all. So we need to look what we can do, and then from there we can move. You know what? This is negligible. This we can proceed. This we can. This we can. So,
I guess I suppose these are engineering students, so they are trying to find new ways for their
yes,
products to be going through, and so
exactly.
I guess they
Exactly.
are trying to find the possibilities to see that if it is feasible or will be a good idea in your opinion
Yeah, but
before
it is definitely a good idea to have that sort of
the
integration.
integration. Right? In my opinion, I've understood that in some hospitals, some of the people's, if the payment process or insurance is not even covered, some procedures cannot be even done on time,
Yes,
and that every second counts when it comes to a person's life. So,
correct.
I guess as an engineer, if we are able to make this more seamless, don't you think, Doctor, it would be
Definitely. That
per
comes
se
to
life
two things.
saving?
Definitely life saving, but another one more thing is you have to understand a lot of such operations come with a lot of bureaucracy.
True.
They come in with a lot of bureaucracy, they come in with a lot of secrecy. Some patients are not keen to. They want the insurance company to pay for everything that they did, but they don't want to tell the insurance company what they did. So that is also a problem these days. So there is sometimes lack of transparency, whether there is fabrication, whether it's misdiagnosed, overdiagnosed, just in order to use the insurance. So these things, sometimes the insurance companies will feel they are left out. They are left out into the whole process because end of the day, like, can I enter into this hospital? You get the green light. Yes, you have. You have a limit of 50,000 to spend, and then when you come out from the hospital, oh, you spend 49,000. So that's when the insurance company will look at it. How come this much of treatment was done? So that's when then they have to dig out and see, okay, was it all necessary? Then there goes up and forth, back and forward with the physician. Why was this treatment done? Was it necessary? Is it justified? So a lot of these things happen in the business segment of the medical industry.
The okay, so I'm not from a business side, and I believe that our students might not be that aware of that particular
Yeah,
concept.
they,
But
they
for
should
the
be aware. You should
potential,
you should be aware
yeah,
this is
they should
happening.
be aware. So I guess there are limitations to having an application through insurance related as well, because a lot of background research or a lot of detective work is done afterwards as well, right? As you mentioned. Okay, so shall we move on to the next question?
Sure.
So the next question is, okay, hi doctor. Will individual data collected for smart healthcare examples of my Sujatra app will be kept confidential, or will there be a loss of privacy? So I
I
think
don't
this is
know. That's
also
the question. I don't know.
I believe this is an opinion-based question,
Yeah,
because
I think
one
I,
thing
I
is
think like I said,
my
as
Sujatra is
much.
government press, right?
Yes, yes. But
So I
has
don't think
has
you
has has information like that, has it been leaked before? We do not know. We
you
do
do
not
not.
know.
Okay.
Yeah, because anything and everything has a security. For example, like, you can put the best lock in your house, but can it be broken? Definitely. It just needs the right tool. That's all.
Well, I guess in this case we would have to trust the government. I guess they're the governing body, so yes, we'll have to trust them in this case for the privacy. But I do understand, doctor, when you mention about that, that there's always a possibility, right?
Yeah.
But
See, when we have that, when the possibility has to be weighed with the benefit again. So if you
but
see that as
doctor,
the app help you a lot, definitely.
yeah, sure. Doctor, today you mentioned that it would be better if we do disclose this information and that we do actually share it, so for better research or better applications, right? In
Yes,
your opinion.
I
So,
think so.
so I have a question. So, do you believe that if this privacy is, per se, lost, or if there is a leak, what would be your prediction of what will happen to people's trust towards these applications, or how these leaked information will turn out to be? Will it all happen to be a huge nightmare, or do you think it will be more suitable, and it will be more subtle, and it will be something that we can live with
I
ease?
think I think we just have to learn to be better if something like that happens. Because as much as you would want to say, like see, I till today I cannot defend what's the definition of privacy. Our phones are being monitored. Once you allow an access to an app when you purchase, when you purchase or you click the app, it's free. The app says allowed to access your photos, allowed to access your friend's phone number, allowed to access your voice. So even when you're talking about something, you say like crypto, search on Instagram, crypto ad comes out. So what is the definition of privacy? Is it maybe you have taken some explicit videos or content on your phone? Someone has access to it. So the definition of privacy is only until you find the privacy was breached. Then you go like, whoa, someone got access to the phone. But you are giving access to all kinds of apps to access your telephone numbers, to access your videos, to access your camera, to access your photos that you snap, you are giving permission. So when even that photo leaks out, you gave access. You gave access to even a print snap medical record through WeChat, through WhatsApp. You get what I mean? You get what I mean? So whether it's an email or the email has been leaked out, someone will just have to take your login or password and take it out and share it. So that is just I would still say it's much of a communication breach really. So apps itself have so much of access to your personal information. So the definition of personal information, is it only your IC? Is it only your medical report? Is it only a diagnosis? Is it only a photo? Is it a PDF file? So this definition of data, I think is already being diluted.
No, very true. It's privacy is a very gray line these days. It's a gray
Yeah,
area again.
it's a very grey line, very grey line. So what is your privacy? I think we have to answer ourselves. We have to ask ourselves first, what is the definition of privacy to me?
Doctor, what do you think privacy related to medical, as in patient's medical history? What do you think is privacy in related to that?
I I think it's very subjective.
Quite
Like I said,
subjective.
it's going to be very subjective. Maybe like, are you comfortable enough that people knows your BMI? I'll ask you, are you comfortable if people knows your BMI? I think you are must be a very person in the right BMI position. You're young. My BMI maybe it's just by looking at you, I might
At
predict
my
your BMI
current
might be,
level,
yeah, maybe
my,
between 20 to 23.
yeah, at my current level,
See,
I'm more than happy to share, I guess.
exactly. So see, so now that information is not private to you, but maybe uh, 20 years down the line, if the BMI goes up to 28, how come you are comfortable then and not comfortable now? But when it's good data. When it's bad, it's secret.
It's
So
secret.
that is the problem. So that is something that I would tell people, hey, come on, what is the definition of the data itself?
Oh, another thing that we can conclude about information in based on what you said, I think it's the perception of how we understand information about other people as well that
Yes,
relates it to
yes,
how private it should
yes,
be.
exactly.
In your opinion, I believe that we should be more open with our health-related issues with each other. I guess that's the way we can help each other. So let's move on to the next question. This question is by Atil. Okay, do you think it's possible centralizing all sensitive data could open this door to a big brother police nation?
Uh, this is a tough question. I
It
think
could.
I don't. I seriously don't believe in centralizing everything. I think with certain technologies like blockchain that is there at the moment, I think we can decentralize and collect. The decentralized and collect. I think one person alone having a lot of power is what we see today that is happening. We are seeing a phase of medical appetite at the moment, where people are being labeled, people are being labeled if they're vaccinated, not vaccinated. So this is what is already being happening. The what Adil mentioned about a police state or big brother position is already happening. One is being ordered to your health beliefs, your practices might be good for one person and not to the other, but that's again a personal choice. If you choose not to go for a back surgery, it's your right. If you choose to take uh, diabetic medication, it's your right. If you choose to cut your carbs, live a healthy life, and not take any medication and in 6 months recover, it is your right. So no one there should not be form of discrimination. There should not be form of any judgment in medicine. Your life is yours to live. You choose how you want to live.
Very good advice. Other than not medical or technical, also we do have the
Yeah,
right to live our lives, right? Okay,
exactly.
shall I move on to the next question then? Okay, this is by Rohit. Doctor, till what extent can rely on automation to take decisions? What's the potential for an AI not necessarily replacing, but being a quicker substitute to common issues?
Okay, I think with high population growth or crisis situation, you want automation. Automations will actually help make the difficult decisions faster because it's already processed and programmed. So it allows the physician to actually ease the hands and see much more crucial decisions that need to be taken. That means that you can actually maybe even set the bar or set the throttle. In these kind of situations, automatic response. For example, even to the extent of temperature regulation. If your temperature is 38, automatically your app might blink and tell you go and see a physician or go to the nearest clinic or take this disease because it's already set. You don't have to line up for 3 hours in a public clinic waiting for the doctor to see your temperature and making a decision. You already can make this. So that is this as simple as automation can be. And let the physician see someone who maybe had an accident who we need to put a bandage or we need to do a suture. So that is where the time position comes in. That's when the AIs can take over. So maybe the AIs might handle the non crucial stuff. They can actually ease the waiting load, the workload, the decision making, or if there is a need to use a Symbian option where you read through the issue, you can actually click without going to a like a story writing decision with the patient. Doctor, I had this, so you can actually take this my symptom. So immediately you can just jump into the thing that you can sort it. But of course, this might be on simple diagnosis, but in complex situations, you might need that sit on with the physicians or maybe in the future have that kind of machine learning to have this emotional compartment component to it,
Understood.
which is where I think the IR4 and all is looking towards.
Yes. So I'll move on to the next question now. So, okay, one second. Do you think that it is possible to over monitor, i.e., with constant reading of vitals being taken, is it possible for a person to become a hypochondriac?
That's definitely possible. That's definitely possible. If you're monitoring the cases day by day, the number of COVID cases, you could be even a hypochondriac. So what I would say is I think it's subjective again to see what are we monitoring. Sometimes physicians have to be very meticulous in what we monitor. Sometimes you can take a back seat.
So it
You
applies
want to
to
answer next?
patients as well as doctors, is it? In
Hmm.
this case.
Yes.
So
It could
okay,
be
there's another.
patients, it could be physicians also.
Okay, so this question is again by another question by Rabba, but quite unrelated, I think. Doctor, do you think different diagnosis using conversational AI like IBM Watson is efficient enough to predict a disease?
No, I think whatever IBM created with the Watson technology is phenomenal. I think they're using it a lot in cancer management. So with the diagnosis, they also can also already plan the treatment plan alongside. So definitely, differential diagnosis is going to be the key thing because you can actually maybe pull in other consultants, other advisors, other specialties to come and see. Maybe some things that you are so focused. There is sometimes there could be a position of physicians having a very tunnel vision, just looking at one thing and one thing only, and they miss something. So differential diagnosis definitely necessary. It allows us actually to get assistance from the other specialties, especially to rope them in also.
Okay, so conversational AI is going to be very helpful. So it's a good point to understand for ourselves as engineering students. So I'll move on to the next question. So the next question is, Doctor, how open is the medical field to implementing blockchain technology, more specifically ledger technology in both handling patient data and even in the smart delivery system for prescriptions as it
Is
is, yeah, as it
Yep.
is.
I think definitely it's there. It's I think it's already happening. It's just maybe we have not seen the end product or maybe the preliminary products, but uh, I think it's no brainer for medical segment to actually adapt this. It's just that maybe it's going to start in small pockets or small hospitals and then grow. Once the concept is already been possible, it's going to roll out. Definitely going to roll out.
You're expecting it, sir, Doctor? Do you believe
Definitely,
that?
I'm definitely expecting it because it's going to be a game changer when that happens.
Okay. I have a very good question, I suppose, from one of the audience. A very um, let's see how you have the opinion towards this, Doctor. How close are we to something like automated surgery?
So we have automated surgery at the moment. I think at the moment, I think the surgeons are maybe on standby or standing alongside or maybe coexisting. There's some devices like Da Vinci, there's like robotically guided procedures where maybe certain minute positions are then done by the robots themselves. So automated surgery, long range surgery is already there. Can you imagine that you have the robot in Kuala Lumpur, but the surgeon gets on his robot maybe in Germany, and he's doing the surgery for you, and there is maybe a co-inside surgeon right beside the machine. If he needs to jump in, he can jump in. It's already possible. It's already possible
So,
with the technology of like
it's
5G. It's already definitely possible.
how about the application of having no doctors be there for the surgery?
Yeah, that's still gonna be a lot of this human trust, and
Yeah,
I think we still a bit more. That journey is still gonna be taking some time. For us to
sometime.
absolutely trust a device is gonna, especially with life, it's still gonna be maybe some time for us to make that adjustment. But this is example like maybe 10 years ago. I wouldn't say maybe 10 years ago. How many people were reluctant to have an online banking account? I think our parents' generation was so reluctant, like, no, no, I would go to the bank, I would line up, I'll bring my bank. But today, many of them are using QR codes.
Yeah,
Yeah, so that's as example, I say, it's like trust in the system.
there's a
The
generation who didn't
system
even
will
trust
build
credit
trust on
cards.
itself. I believe that.
Mm, Doctor, can you hear me?
Exactly. The system will build trust on itself. So, in terms of medical technology, that's definitely going to happen. So, automation will definitely take place.
Yes, automation. I'm hoping for that future as it will be very beneficial for us engineering students or engineers in the future.
Sure.
So, shall we move on to the next question? So the next question is by Rapa as well. What are the current challenges faced in healthcare logistics or supply management? How can we make it more accessible and consumable, consumable, especially for common people in rural and remote areas? This is a quite good question, in my opinion.
Okay. So, this is also been already happening already. For example, like when we look into healthcare logistics, uh, few things you need to understand. Scaling up brings down the costs because maybe the cost to engineer something it's very high. If there is a quick demand or a supply, there's going to be price throttling down. So that allows more access. But maybe for more specific kind of tools, uh, we still need to see whether new ways of delivery can happen. New ways of delivery can happen. For example, like there's a study of in Netherlands where they have an AED drone. So an AED is sort of like a defibrillator where you shock someone who got a cardiac arrest. So can you imagine in hospitals that these drones are like all parked, all charged up. So if there's a ping or one of the rescue centers like, look, we need an AED, they're just going to hit the button. Straight away the GPS picks up, sends a relay to the drone, and the drone just flies up, and maybe the drone can actually reach faster than the ambulance. It can fly by to the ambulance, reach the patient. There already the thing has already been up. The machine guides you where to place it. There's a screen, or maybe on top of the screen there's already maybe a video to communicate with the response center what to do, and immediately people can actually integrate while the ambulance comes in. So this can happen in terms of like this is what I call a short range, long range kind of technology. Simple technology. It looks like it's just a drone, but can you imagine the drone can fly faster through a traffic jam, get there first, communicate, and as the communication is happening, the ambulance is coming. So maybe you need to defibrillate that person who has a cardiac arrest. That can be done immediately. So this is already there. It's already there in the world. It's not even like something that we are thinking about. It's already happening.
It's already happening, yes.
It's already happening.
Okay, so I'll move on to the next question. So, how
Yeah.
effective is virtual reality or augmented reality technology for medical students or doctors during the e-learning era? Doctor, I think we are facing a little technical issue. I'm sorry about this, viewers. Doctor, are you able to hear me?
Yeah, I'm able to hear. I got the question. I got the question. There's a slide
Okay.
like that. So uh, since we're still using 4G. Okay,
Okay, we're
so
still waiting for the
regards
adaptation.
to the question, whether it's whether virtual reality, or definitely, I remember being in medical school where it's all textbook, and then today we see the power of YouTube, the power of a new way of learning VR. Did you get me?
Doctor?
Did I break? Did I break? I'm back. Did you miss?
Yeah,
Did you
yeah,
miss
you're back
anything, Nassim?
now. Yeah, you were mentioning about YouTube, and then we were able to
Yeah.
have a
So
stuck.
if you see the technology of learning as simple as YouTube, can you imagine that technically with even your YouTube, you probably get probably the best medical lecturer, maybe for best way of delivery, because not all teachers can actually teach
We're having quite issues. Shall we check on our
Hello.
sides? Let's see. Yes, I can hear you,
I
doctor.
think
So,
there's a slight delay in sound. Yeah, so definitely it's going to be super effective. It's going to get students get the best information, the fastest knowledge, and allowing them to absorb and allowing them to study other things faster too, rather than we just live around and just like keep mugging down for exams. I think these new platforms allow students to actually explore more, question more, and discover more beyond just their classroom, where they can actually get another viewpoint from another lecturer worldwide. Maybe his delivery is better, or maybe your teacher is better than him, where you can actually teach other colleagues around the world too. So I think it's borderless already. So this kind of virtual reality, augmented technology, even digital learning is going to transform every single field, not just medicine.
but we would have to realize and notice that there are always limitations in this technology. As such, we are seeing now we are having some disruptions in the stream. Doctor, are you there? Are you able to hear me properly? If everything is good from your side, I'll move on to the next question. So the next question is hi doctor, in terms of developers under private firms, is it easy for them to tap into health industry? Is the restrictions around patent data capable of restraining business practices?
Restriction around patient data to restricting business practices. Definitely. So the flexibility has to be there. I think going quickly into this question, I think it's all goes on to the flexibility of countries, of organizations, of certain communities being maybe liberal towards the data, or maybe being very restrictive, being very belly with the data. So definitely. We can take the next question.
Okay, I'll move on to the next question. Would employing more and more technology in the healthcare push the cost of healthcare higher and therefore make it more inaccessible to the poor? I think this is a quite good question because some of our scope is related to more remote and different
Okay.
aspects of wealth,
So
but technology in health.
answering to that question is it's not about the technology that matters. The technology can be there, but it's actually using the right technology for the right thing. Doesn't mean that if, for example, doesn't mean that you have a small laceration wound in your arm, you must be put into an MRI machine. You do not need to. The physician already will know it's just a wound that he can switch it. So if you misuse technology, then the cost becomes high. So right diagnosis is very important. So whether it's high technology, yes, that could be the highest technology ever, but whether it's used at the right place at the right time, that's where we're going to make the access healthcare to be more efficient. So I think whether rich or poor, it's going to be subjective, because I think healthcare should be, as much as it universal, it has to be also accountable. We cannot blame ourselves to be rich to access the best healthcare, but we cannot blame ourselves to be poor and being denied, because healthcare is going to be a responsibility. If you choose to eat high sugar foods and processed food, and you get some cardiovascular disease, you cannot be crying and say, "Look, oh, I don't have access to hospital because I cannot afford." You were able to afford all the bad food last time. Okay, so maybe there's a swing too much, but I think to say is right technology, right management is more important than losing in terms of looking at the cost. Technology will evolve. Technology will be there. We will embrace new technology. Of course, sometimes the cost can be high, sometimes the cost can be low, but we never grumble when the cost goes down.
We are only trouble when the cost is high, right?
Exactly.
Well, I understand everything is at the end of the day related to business models. So I think this question came up with the thought that
Exactly.
we should be able to cater for all economic levels when we are developing as such. So
Yeah.
I'll move on to the next question. This question is, what are your views on smart pills? What could be the downside of such technologies and advancements?
I think we gotta see smart pills into two things. Is it, are you referring to the camera pills, or are you looking into customized treatment? I think maybe the question was more of the customized treatment. So customized treatments are already, it's already there. Even I use it in my clinic. So for example, if I have individual A who has a certain kind of disease and which needs a certain kind of therapy, and he doesn't need to take like 5 tablets, I could actually request a specific compounding pharmacy in Kuala Lumpur to customize to all the ingredients to maybe to one pill or two pills, and I get the delivery done. So he just has to take one tablet, customized to his body type, customized to his illness. So it's already present at the moment. So it's not even new technology. It's going to get more drive. It's going to get more momentum, because people like things now personal and customized.
Okay, so yes, for
Are we down
now,
to the last question?
Yeah, I will give you one more question before you leave, Doctor. It's another
Okay, sure.
personal question from me this side. Okay, so it will be the last question. It's not per se related to tech, but it's more relevant to the current times that we are in. So,
Okay.
Doctor, what do you think about the current pandemic situation as of now? And are we going to be coexist with the disease, or in this case, the virus? Or as time goes by, what do you think will be the change and everything will be? How will we be living in this current? Do you think the
Situation.
pandemic will be there forever, or do you think it's gonna be another part of the history books?
Definitely parts of the history books for whether it's success or mistakes that we made. But I think that I think this is a hot question. If those who know me, who have seen me before on online on my platform, this has been like the hot question. I think moving forward. In fact, today 9:30, I'm actually having a discussion on our own show called the Healthy Rojak Show. The cards have we won against the pandemic? We're going to have that discussion at 9 today at 9:30. So, answering Zain's question in regards, is the pandemic over? I think a lot of countries are realizing that they cannot be too clingy and hoping that the pandemic is going to end in this way. They have to move into an endemic position where they're going to live with the virus. So the virus is going to be here. We can never have a flattening the curve kind of perspective. We want to see that the vaccine has much more benefits than the risk. We need to protect people who have taken the vaccine. We have to see patients who had side effects from the vaccine. We also need to look at people who are not deciding to take the vaccine, what we can do for them, how we're going to improve our health, how we're going to make sure that we take our health into our own hands and control it, not just depending on systems, not depending on your insurance policy, not depending on government. You need to ensure that you own your own health. That health part is your own decision. You are in control. So tech wise, medical wise, the pandemic has brought a lot of awakening to people to really take care of their health. Because whether you are young or you are old, you still can be the victim of the virus. This can happen to anybody. So if you choose to have a healthy lifestyle, boosting up your immune system, eating cautiously, socializing right, reducing alcohol, reducing smoking, and stuff like that, this will actually be a plus point and this will be a benefit towards you. And this is what we see. This is like basic biology, survival of the species.
Yes.
So the most strongest ones will thrive. Of course, we need to protect the ones who are weaker with technology that we have. We have like vaccines, we have this preventive measures and stuff. But I think the world will start to move on fast. We're already seeing what's happening in like other countries like in Europe and all. There's no mandates, there's no force. I think yesterday we moved into phase 4 in Klang Valley. So there is progress. We should not be sobbing ourselves and being sad like, oh, this has happened, because I think we need to move forward, having a clear mind, being positive, staying positive, moving forward in the world that is constantly progressing. And if you are hit by the pandemic, mentally, emotionally, financially, uh, we should just look that this is like a time to get back feet and evolve, learn through the experience, and tomorrow the sun is going to come up again.
Thank you for your very hopeful advice, Dr. Roland. So, let's see. I'll summarize a bit. So today you've answered somewhat a lot of questions from our class, and then you've personally answered some of my personal questions that I've come across during the event. Thank you for that. And we've had a lot of questions from the comments from our viewers as well. So I believe today has been a very good and interactive session. But however, I would like to give you an opportunity, Dr. Roland, to give out a message to the audience and for us, maybe a few words of advice before we end for today, that we have before we conclude the event. So please
Okay.
do share us your wisdom, Dr. Roland.
Okay, so before we end this, just a quick message to all. Thank you for all of you who are staying tuned. I saw all the messages, the comments. They were very good comments, positive comments. What I would like to say to you, guys who are in the final year, final year, right?
Yes, finally.
Final year of mechatronic. I think always stay hungry. Don't let anyone tell you that you cannot do it. Don't let anyone tell you that you cannot do something, especially in the field of engineering, especially in the field of science. The field of the field of science is always to challenge something new, to develop something new. So as long as you're going to stay hungry and think about things, you're going to achieve that dream. So not just to pass the final exam, but have a mind that look, you are going to be the future engineers. You're going to bring new ideas, electrical or whatever the tech that is going to come there. Just stay hungry.
Thank you very much, Dr. Roland, for your advice. Um, so we are almost at the end of our event. Before that, I would like to thank some. I would like to give a few message of thank you notes. First of all, for you, Dr. Roland, for spending all this time with
Welcome.
us. I've been communicating with you back and forth for a long time now. You've been very, very helpful. You've been very easy to communicate. You've been very open up, and it was lovely experience working with you. So, and it has been much better seeing you today in this event and giving all the wisdom that you have given us, all the insight. I think this will be a benefit for our students, that our class as well, for our related module. I would like to thank our lecturer, uh, Jacqueline, for giving us the opportunity, for making this happen, making this as a reality, for being connecting you with us as well, and making this a very insightful and very important part to assist us greater to achieve better for our module. I would also like to thank all of my colleagues who assisted me, all the hosts, Jamila, and Garab, and colleagues in my team from the organization side that you might seen. One of them very active today, asking questions, Rabah. Another friend is Fun. So I would like to thank all of them. Thank you very much, Dr. Roland. Thank you, everyone. And I hope you all have a wonderful day and holiday wishes. Thank you very much, Dr. Roland. I'll conclude the event for now. Right now, I'm sharing on the screen the attendance code. So I'd advise everyone from my class as well as the participants, if you can go through it, there's a good question related in the attendance form that you might be able to answer. I would like to see who actually are able to answer. It's not much of a difficult question, but please do go forth. Once again, thank you, Dr. Roland. Thank you,
Thank you
everyone, for
very much.
tuning in, and
Take
hope to
care.
see you soon, Dr. Roland. Maybe in another
Bye.
event.
Sure. Bye bye.
Thank you.